Welcome back to the Rewired and Reimagined podcast. Today we have our guest is Natalie Hope. She is a clinical counselor and she is going to tell us a little bit more about herself. So welcome, Natalie.
Hi guys, I'm excited to be here and finally kind of connect Jenny more with you too. Thank you for having me. I am a registered clinical counselor with a master's in counseling psych. I have training in somatic experiencing, trauma, addiction, and I also offer prayer ministry, which is a big part of what I love to do in my purpose. I sort of have my own journey with that. So I got my master's in 2012 in Vancouver, BC. And essentially from there, I just was always drawn to trauma, the spiritual aspects. And I quickly kind of realized that healing is something that isn't just, something that happens through talk therapy or like our mind or our thoughts. Because we are a 3-part being, body, soul, and spirit, there is definitely a spiritual element to our healing. So that was something that I really started to ask more questions about. I got really involved into more New Age spirituality, and then I had an experience with Jesus in 2018, and essentially I went through a process of healing and deliverance myself with my mentor who is a pastor. And from there, I learned a technique called prayer ministry. So that kind of works on inner healing aspects of trauma that we might go through, or life experiences, or getting stuck into patterns of negative cycles in our life, and inviting Jesus into that, inviting the Holy Spirit into those things and into those places, and basically getting freedom from a spiritual point of view. So getting freedom on a level of the spirit and the soul. So it's been a journey for me for sure. And yeah, that's just kind of like a
Good morning. This is Natalie Hope. She is our guest today on the Rewired and Reimagined podcast. She is a clinical counselor and is from Canada, and she has an amazing background and a kind of story that has led her into further pursuing her healing nature that she has within herself as a counselor. And so I'm super, super excited to have you. I love, we connected a while back, and I think we've always just kept connecting. So I'm excited to have you on the podcast today. So you can kind of go into a little bit more about yourself. And
Absolutely. Yeah, no, Jenny, I'm so excited to be here and just be connecting on things that feel like almost divine alignment. I love when that happens in life. And for whatever reason you're drawn to certain people, and it's just like, oh, maybe there's a bigger purpose here, a bigger reason for this. So, I think that's definitely something I felt with you from the beginning. It helps that you're living in my favorite place in the world. But yeah, so hey guys, I'm from Vancouver area, British Columbia, Canada. Um, very far away from where Jenny is. I do have a master's in counseling psychology, and I graduated in Vancouver from Adler University in 2012. I did take extra training in something called somatic experiencing from the Trauma Institute. And that is essentially where we work with the nervous system as we're doing talk therapy. So we are identifying patterns in the nervous system that happen when we go through trauma, and working with the Holy Spirit and with counseling and techniques in somatic experiencing, we sort of learn to release some of those patterns. And we can kind of get into that later. So this was always hey girl. Can you hear me?
Yeah. I was like, I don't know if it's
The only other thing I can think of is like
we can just keep going. I think we could just
I'm on my I'm on mobility, Wi-Fi or whatever, and then I'm on my phone, service. So should I don't know, but it says I have full bars. So I'm just kind of like, I don't know what's going on. I don't know why it's not loading the right way. I don't know if I should maybe try to disconnect from the Wi-Fi and see if my phone just ends up working better. Like, we can always try that. I don't know why that would be the case, but I did just turn off my Wi-Fi. So now I'm just on phone signal. So maybe that will do something.
Yeah, we'll see that, because I feel like you were kind of like lagging, but it, who knows? It could be the riverside.
Mm-hmm.
Okay. And we can, like I said, we can crop some of this. I just kept it running, and we'll just crop it out just in case, because if it keeps happening, we could, I think it'll be fine, that piece will
just do sections. Yeah. Okay.
Yeah. Well, hopefully it will.
I can always. Yeah, I could. So do you want me just to start off where I left off then? Kind of thing?
Yeah. Or you can start from wherever you feel comfortable starting off.
Okay.
If you want.
Yeah, maybe I'll just start from the beginning and then try to go through that like maybe a bit faster, and hopefully this works now.
Or do you want me to start from the beginning, or just?
Yeah, let's try that and then see if this will.
Then we can. All right. Good morning and welcome back to the Rewired and Reimagined podcast. This is Natalie Hope. She is a clinical psychologist out of Canada, and she is here today to talk a little bit about what she does. And she kind of has a background story a little bit. Natalie and I met kind of through social media, actually. And I think we connected and kept reconnecting. So I think we have a lot of similarities, different stories, similarities, but I think we're both like walking in our purpose, and are feeling that. And sometimes that's a real hard thing. You don't always see people that are having those experiences, and it's pretty darn amazing. So I'm super excited to have Natalie tell you a little bit more about herself. And we have a lot of things we'll dive into, and then some cool things that we have on the rise. So welcome, Natalie.
Aw, thank you so much, Jenny. It's so cool to be here and just finally connecting in this way with you. But as I said before, I feel like, our connection is something that's like purpose driven. And when you have that kind of divine alignment for whatever reason with a person, you want to follow that, right? So I think it's really cool that we're here and that we just can't kind of get to share our passions a little bit and what we feel we were placed on this earth to do, and what that means moving forward. It's a pleasure to be here. So I'll just kind of tell you guys a little bit about me. I am from Vancouver area, British Columbia, Canada, which is quite far from Florida. But I did my master's here in 2012. I graduated, and it's in counseling psychology. So I'm actually a registered clinical counselor. And I decided that I was very interested and always drawn to trauma and the nervous system and body, soul, spirit type of healing. So I did take a course, 2 levels of what's called somatic experiencing, and it's from a place called the Trauma Institute. So what that is that's different than regular counseling is basically we look at the nervous system and the different traumas we've been through in our life and how that impacts mental health, how that impacts even cycles that we go through in life, the way we respond to triggers, the way we respond to life. And what we do in the counseling session is a little different because we're always tuning back into the nervous system to see where things are at. And the goal is essentially to create a space for healing so that you're not continuing to get caught up in those nervous system cycles in the same way. So that's a little bit about my counseling process. I do have experience with addiction, but my big sort of thing that I'm on fire for and I love is prayer ministry. So I have been through a journey where I, was always drawn to the spiritual. I always felt like, okay, counseling and talk therapy just does not cover the healing that we need as human beings. God created us as a 3-part being, body, soul, and spirit. And what this means is that if we are not receiving healing for our spirit and our soul and our body, there's always going to be something that does not quite feel completely free, right? That we're not walking in the healing that has been meant for us by God. So, this is something I was led to even by my own experience. So when I came to Jesus, I did go through a period of healing, inner healing and deliverance with a pastor who's my mentor. And I learned a lot from her. And that kind of led me into wanting to go into prayer ministry. So I took training in prayer ministry, and that's kind of my go-to now, along with the nervous system work with clients and with people that I come across. So what that means is we ask the Holy Spirit to come into sessions and reveal different things that need healing. And, they do talk about how the Holy Spirit is the greatest comforter, the greatest counselor that we could ever have, right? So I feel that any kind of counseling that doesn't include that, especially if you're with faith, there's something missing in that process. And because I saw the breakthrough in my own life and the healing in my own life from that, it really inspired me to want that for other people, want them to have the freedom that only God can really bring to us, right? So I'm honored to just be walking in that right now and having that purpose just to move forward. So thank you so much, Jenny, for kind of letting me yammer on about myself a little bit. But yeah, that is me.
Yeah. And I think that's cool that you say that, because I think I have kind of went through a little bit of traumatic experiences myself a few years ago. And here I am doing this now, right? And I remember at the time too, I was really, really diving deep into my faith. And it was like the only thing I had to lean on because it was just stuff like crazy stuff happening in my life. And I'm like, what is going on? Like it was just this like
Yeah.
massive amount of trauma. Realistically, my kids and I were going through. But it was, I would pray, whatever. And and everybody's telling you what to do, what you should do. You should do this, you should do that, whatever.
Yeah.
You should feel this way, you should do whatever. And I would get so
Yeah.
confused in a state of where I was like in a fog. And I remember like praying and I would just get peace about, because I had to make a lot of decisions during these times too.
Yeah.
And I think it was like that I was like, I just had peace about it. And sometimes the decisions that I was making was people were like, you're crazy. You're going to do this. You're going to move there. And I was like, I have so much peace about it, but I wasn't super, I was leaning on my faith, but I was still diving into it, if that makes sense. So it was like, for me, it was, and I remember, after going through it, like, oh, are you in counseling? That's like the typical thing. Like, are you in counseling? Whatever, and I had taken one of my children to a counselor and he was very not talking. And I remember, so I would kind of talk to him and I just didn't really feel like I needed it. Like I said, I really just would pray. And I had some really good friends that were my counselors, right? Because sometimes there's a variance of counseling. And I was like, I had good coping skills. I had like, I understood what I was going through. I understood my feelings. I understood like that I was responding. I could psychoanalyze what I was, everything, I didn't need someone to tell me that. So I was like, I don't really know what I'd get out of it. And I remember, I remember even telling my mom, I was like, well, the good Lord's that's my counselor. Because people are like, these decisions you're making. And I think, that you have to almost sometimes, I remember too, like getting quiet about it. I had to get quiet about, and then, I would just like listen to pastors and dive deep into my faith and like just reading, all this stuff in the Bible, it kind of tells you that, right? Like sometimes it is beyond your understanding. It's beyond everybody's other people's understanding. And you just had to, but you had to have that clarity of like, I got clarity from the Holy Spirit, like, okay, I have my clarity and you just have to go do it. And then everything that transfolds after it. It's a beautiful thing because then it's also like people are getting it. And then sometimes it will draw people closer to the Lord because like, wow, he just did that in your life after this. And it's so off the wall, right? But that's how God works in our life, right? The minute we try to control everything. And I think that's what when you're talking about the healing component, I think, bringing the rehab piece into it, I think of that too as like these kids come in and, I know you'll go more into the central nervous system and stuff, but that it is a missing piece. Like when I'm in a hospital, when I was in a hospital setting and you're going from like patient to patient to patient and they are in fight or flight and you're just like, oh, are they sitting? Are they standing? Can they do this? Can they do this? And we're totally neglecting and ignoring the most important thing, right? Like the most important thing. So I love that you're bringing this here and bringing light to it. So I think it's something that a lot of people need to hear. I think it's a cool topic, and I love what you're doing. I think it's pretty amazing. So.
Well, thank you. And thank you for sharing that just about your story. I think for whatever reason, when we get in the world, sometimes we feel like we have to just stay quiet about our relationship with God or what God's doing in our life. And like you said, it's like people are watching you navigate these almost impossible situations that are something that comes out of like a horror movie or a nightmare, and you are just supernaturally getting guidance, right? From the one who knows like the end from the beginning, the one who knows, the whole purpose and storyline of your life. And so it only makes sense. Like, why are we going to people who, number one, aren't leading you back to who created you? And why are we taking advice from people who, don't necessarily know what God has planned for you, right? So I just think that's incredible. And, I think that's part of what makes you a unique therapist and a gifted therapist, is that like you have gone through this in your real life. You've gone through trauma and you've had the Holy Spirit come in and lead and guide you. And then, you've learned to trust that, right? So then when you work with clients, it's like, oh, I have to pay attention. And it's like, some of the world calls it intuitive, right? Some of the world calls it, what's the word? Like when you have empathy or when you can feel other people's emotions, right? And it's like just this knowing that you have in your spirit. Yeah. Do you want to talk more about that?
Yeah. I think like what you're saying that too is I think before I had that intuition, right? Like I think at treating as a therapist, right? Like I would work with kids and I would just like intuitively think of something else I could do with them or something I could do that I knew it would help them. I could feel, you kind of like feel their feelings. I do a lot of manual therapy, so craniosacral work, fascia work.
Mm-hmm.
You have to have a really good sense of touch or intuition to,
Yes.
and it heals and it heals in a different way, and I worked with a lot of trauma, but trauma like car accident trauma, all of a sudden you have a brain injury and the child maybe lost their parent during the accident. I've seen kids with amputations, gunshot wounds to the head, like gunshot, spinal cord injuries, really, really child abuse, so much trauma, in you're like, as these kids are waking up from a coma and then as they transition back into home community, you're immersed in all this, right? And
Mm-hmm.
so I would use those healing components on top of it because I knew they worked. I was like, for some reason I can like and then a lot of times it's like you can get people to start talking, like some of the teenagers like start talking about the trauma after you do a release, but it's um I'm seeing a new patient every hour, right? So I'm like going through and I'm like, okay, I know I'm helping heal people, whatever. You're pulling in all these things and there's a component, but it's very scientific, like, oh, I'm controlling it. This helps release this, which we hear, when you
Mm-hmm.
go to the courses, it's like, oh, it can release emotional trauma. Um,
Mm-hmm.
but then fast forward to when I started my intensive clinic, I don't know how to explain it, but it's like a light bulb went off. I was like, this is like crazy. There's so much more to
Mm-hmm.
this, right? And I finally had the time and I didn't have the pressure of the system. And then I was leading with purpose, and I was leading with like, this is what God led me to do.
Yeah.
And I didn't realize it was even more. So I think sometimes people will be like, oh, you do things different. You do whatever. You do this different. What are you doing? And
Yeah.
whatever. I think too, yes, I'm using all my scientific principles, all those types of things, but
Yeah.
there's so much more to it. And I'm gonna, there's that spiritual component that you bring into it. And
Mm-hmm.
it's not like we're sitting there, um, focusing on that the whole time the child's in therapy at all. But I'm gonna tell you, there's that component that works through me with these children. Um,
Yeah.
and the healing is different, right?
Yes.
It's different. And even the things that I think, the ideas that I have in the programs and the different things that I think that is like there's a component of not just scientific healing
Mm-hmm.
that's rolled into all
Mm-hmm.
that, which is pretty cool. So I know what you're saying.
Absolutely.
I don't know. Sometimes you see stuff that happens and you're like, why did that have to happen? And then I've
Yeah.
also seen kids recover from stuff that they shouldn't ever recover from and doing
Right.
things. And I remember seeing even your story and your son, and I was like, how the heck is that kid doing all that? Like, that's amazing. Just kind of and I see that more than I don't, right? And I've seen a lot of kids in the past 18 years that have gone through some stuff, and there sometimes it's like science can't explain that all.
Yeah. No, exactly. And that's kind of where the world and what doctors say, and science ends, and then where like miracles happen, right? And things that can't be explained, right? Because you're opening the door to a different force that's at work, even in the work that you're doing. And I truly believe that God is healing through your hands, right? And through your intuition, and through, like, it's an art what you're doing with kids, right? You are being led by the Holy Spirit and the science and all the things you've learned, and God created you exactly to be this person, right? And so because you're surrendered and you're listening to him, and like he's guiding you, then your creative part is coming on, and you're saying like, this is what they need, right? And all these programs and things. So yeah, that's just so cool.
Yeah.
It's so cool.
Yeah. Like you said, is that the creative part, or that's the part that God's working through. I was like, I always say, well, people are like, oh, how do you think about that? I'm like, that's the brain that God gave me, right? Like sometimes it's like too much.
Yeah.
It doesn't stop thinking of ideas. Like it's annoying. It's annoying. And
Yeah.
I think this is like, oh my gosh, like I think I talked to one of a girl that works for me in the summer. She's in OT school right now, and she's like, you're like doing this and doing this, and I'm like, she's like, how are you doing it all? I'm like, because it's not like, it's actually really easy and I'm enjoying it, but because I know what's leading me. It's not me leading myself. It's me like, you're
Yeah.
supposed to be doing this right now. And it's going to help that many more people and reach that many more kids. And I think there even the component of healing parents, because I think that's a big missing piece. And I think that
Mhm.
you as a professional too, I think, I'm excited to kind of see where all your new stuff is going too, just because
Mhm.
I just feel like you have such a presence and you've gone through all this stuff, and I think you're going to help a lot of parents heal.
Aw. Well, bless you for saying that. Yeah. I guess if it's okay with you, I can kind of talk a little bit about my story, just because I think that'll give people an understanding for things. So yeah, so in on June 1st of 2023, so I have two little boys. They are now 6 and 4, and basically we were living near a lake, and June 1st of 2023, I was with my younger son at the time. He was like a year and a half. And I had gone in to like change his diaper from like a balcony that we had. And during that time, my then 3-year-old had let himself out of the front door and gone on his bike. And by the time I had gone out to run after him and look for him, I could not find him anywhere. So I went up the street. I went towards the lake. I just literally was like, he's vanished. He's gone. Right. And all the while, I have my little baby at the time with me, my other son. Long story short, like, he was found floating in the water by me and my other son. He had drowned. He was completely dead. He was gone. And obviously, I'm talking about this the way I am now because I've done a lot of work around it. I've done my own paraministry with trusted pastors and ministers, and on my own counseling, right? My own nervous system work. But obviously, it's every parent's worst nightmare. It's the thing where you think, pinch me, because this is not real. This is a living nightmare that I'm living right now. That was what happened to our family. And essentially, I dove in. My other son was in the stroller, and I grabbed him, drug him up on the dock. And it was just like his eyes were wide open, but he was gone. Like, there was no life in his body. I just started doing CPR and screaming, at the top of my lungs. And by God's grace, there was actually a man who happened to be like walking kind of by, and he was a retired firefighter. And believe it or not, he was like there that day because he was receiving an award for reviving a man who had died for 7 minutes. And I was like, okay, like, I found all this out after, right? But you just look back and you go, oh my goodness, like, God was there, right? Through these people and through these circumstances. So he took over for me. the fire hall was called, and like a whole crew of about 7 firefighters showed up like very quickly. Also, they were not supposed to be there because we lived in kind of like a lake community, a small community. They were doing training, and it was like some night that they had just been called in to do some kind of training, and that's why they were there. Otherwise, it would have just been like maybe one person there or something like that. So just all those moments, right, you look at and go, okay, God, like you were part of this, you were there, right, through these people. Long story short, like I just started praying because it was my go-to. It was like my, you know, Lord, this is life and death. Like, I need you to come through. I was just praying over his body. I was like breathing over his body. I was like, Lord, like, come and do something in this situation. And they estimate he was in the water for about 17 to 20 minutes. And what had happened is we found video footage of he took a bike and he actually rode it straight off of a long dock. And so basically that's why like I couldn't find him, because I was looking, everywhere else. I was looking on the shoreline, but he was like way out. So I had eventually led myself down halfway down a dock, and he had like floated back halfway, and he was still wearing a pamper at the time, and that's why he was floating, believe it or not, because he probably would have been, under the water. So it's just, crazy to think the length of time he was in there. It took them, I think, another 15 minutes. And then I'm praying at his feet the whole time. Like they're working on him. They're doing, the resuscitation. And then he got a heartbeat back within like 15 minutes. There's certain things that I look back and I go, in that moment for me, it was like the Holy Spirit was like, it was like I didn't even have my own mind, because I was almost like denying that it was going on. And it was just like my aunt at the time was living up at Cultus Lake, and she's a pastor, and she was like driving down. And obviously when she heard, she drove down, and we just like, my husband was coming home from work. So he just had arrived. It was her, it was me. We put our heads together as they're like doing the work on him. And I just looked at them and I said, don't you dare like give up on the fact that he's going to live in Jesus' name. Like he's living, right? And like the words we speak are so powerful, right? Like what we say over people and the beliefs that we have in our head, like never underestimate that, right? And I was just a mom not willing to accept that like my son was going down, like that he was going to be, gone early from this life, that it was not meant to happen, that was not meant for him. And so I was just like, no, he is going to come back. And I believe that, I didn't fully understand it at the time, but the only thing I can describe it as the supernatural power of faith working through me, just saying, no, like he is going to live, right? And long story short, he got airlifted to a children's hospital, and basically he was in there intubated in kind of an induced coma for 2 to 3 days. They told us, he's probably not going to wake up. They kind of advised us to think about letting him go. They said his brain activity was irregular. And the whole time I was just like, no, that's not what's happening. Right. And I mean, I know the doctors thought I was crazy. They were like, okay, this lady's certified, because I just was on one. And I said, in so many ways, like I remember we had a doctor come in to the room. 2 doctors actually came into the room when he was having these heart rate spikes, where his heart rate was going up over 200 beats a minute when he was neurostorming, right? And they said, like, there's a likelihood he's going to die of a heart attack, and he's probably going to, like, you could lose him tonight. And they were trying to, like, I know they were trying to prepare us mentally, but when I say supernaturally, what I saw in that doctor's eyes was death. I was like, you are speaking death over my kid. And I said, no, that's not happening. And this happened twice with 2 different doctors. And it was almost like something in them was really aggravated that we had so much faith and that we believed he was going to wake up and be okay. It's like they did not want us to have that. They wanted to discourage us. And I don't think it was on purpose. I think it was something spiritual at play. They're taught that, oh, when someone has no oxygen for this long, when this happens to someone, like, they don't recover. They're taught, like, and they see this probably a lot, right? And this is going to happen. We've seen this before and all this stuff. And it's just like, God is the only one that knows what is the end of your story or your child's story, right? Like, no doctor, no professional is going to be that voice unless you let them, and that's one thing I just want to share. If there's parents out there, like, if you feel that the Holy Spirit is saying to you, or your gut is saying to you, this is not what's going to happen, or no, like, I'm not accepting this, and this is not what my child was going to happen, then you need to lean into that and trust that and be led by that, right? And be like action led by that faith and that gut feeling, and so essentially, sorry, I'm rambling on, but I'll just kind of go through all the, yeah. So I'll go through, basically, we ended up connecting with a family who had gone through this before. I looked up miracle drowning stories online, and I found the hyperbaric oxygen therapy, right? And it led me to reach out to some families. And right away, the dad got back to me and he's like, no, my son, went through this. You need to take your son now, like, to get hyperbaric oxygen. So here I am printing out studies. I'm showing them to the, who is it? The neurologist at the time. And the neurologist looked at me like I was a psych patient. I said, this little girl, look at how she's doing. And she did hyperbaric therapy like right after she had her drowning. And I think she was gone for like 2 hours or something crazy. And he said to me, no, like, we don't have any kind of empirical evidence in the medical system to say that this helps with near fatal drownings. And I just knew, like, have you ever had that feeling in your gut where it's just like, no, this is going to revive my son. This is going to help my son. I need to get him to do that right now. And so I just, everything, they tried to like fear monger us, get us to stay. They had him on so many medications, which I know some were necessary for that time. And I just looked at him and I'm like, you are not healing in this place. Like, I looked at him in that hospital bed. I'm like, you are not healing here. I have to get you out of here. That's what my biggest feeling was. And the faith part of it, I didn't talk about, is like, my husband and I fasted and prayed for 3 days. Like, as soon as it happened, we didn't eat at all, right? Like, we just were like, this is life and death. We had a whole church community praying. We had people coming in, laying hands on him, praying for him, like, throughout the day, right? Like, as this is all happening. And every single one of those people, we're told, if you're not believing for healing and like for him to live and have life, then don't pray, right? So I know that sounds horrible, but that was our mindset at the time. It was like, if you're not on board for what God's doing here, then respectfully, we don't need your help, kind of thing. So that was a big part of it. I believe that, when God's army comes together, miracles happen. And that was the story for us. So we ended up we had a GoFundMe, and it got, I think, like $67,000 or something. And it came to a point where it was like, I need to get him to see Dr. Harch, because we had a consultation with him, and he said, I can't make promises, but, all these things you're telling me about your son, what's going on with your son, are good. And, he said, come down, right? And he was not rushing us, but the dad of the little boy who had drowned and had a really good outcome was saying, like, the sooner you go, the faster the brain starts to heal. And so basically we got him on a private flight with all the money from the from the GoFundMe. That's how much it was. Just in faith, because he couldn't sit on a normal plane because he was like couldn't sit up. His neck was like that, right? And he was like had feeding tubes, and there are so many complexities to the story, but long story short, we took him to New Orleans. That was a full faith decision. It was scary because he was still on meds. He wasn't eating food, so we had to learn how to, feed him through the nose tube he had. And basically, he did 32 sessions with Dr. Harch. And on the second day, he started, like, we were like, move your head this way. And he was just like on a pillow, and he was like starting to follow that direction, right? And very slowly starting to come back. And so basically, this was something that I just knew. I was like, he's got to do this. He did it. And, it was not without complication. There were things that happened, like, we were trying to wean him off medications with the help of a pediatric doctor there. And it was like he had all this withdrawal, and, he was throwing up and all these things. But, you know, it was really just, instead of listening to the doctors from here or, what other people were saying, it was, okay, what is God saying, about his life? And I remember even when we were in prayer, even like the first night he drowned, like I closed my eyes and God showed me a vision of him when he was like a 20 something year old, and we were at church, and he was like, Mom, God is so good. And he was talking to me, and he was whole, and I held on to that for dear life. I said, God, you show me this so that I could believe and take the next step and take the next step. Even if the doctors are saying this, even if these specialists are saying this, like, I know what you said to me, what you've shown me, I'm going to walk forward in that, and so that is what I held on to. And it was not without trauma and fears and setbacks. There were so many setbacks. Like, my son had the tube for like in his nose for like a year and a half, I think, because he couldn't drink fluids for a while. He was aspirating some of them. But I just knew he wasn't supposed to get that stomach button, because I was like, no, he's going to. And I remember one day when we were back home, he looked at me when I was eating like an egg bite from Starbucks, and I was like, he wanted it. I could tell. He's like, he wanted food, right? So I just like chewed it like a like a mother bird, and I like put a little tiny piece like in the side of his mouth, and he started to chew. And it was like 6 months before he was fully eating, but I was chewing his food for him. Like, believe it or not, it sounds so gross, but like his favorite foods.
Yeah.
I was like, this kid is gonna eat.
Yeah. Oh, I love that. Because usually I feel like usually that piece comes like way, way later too, right? Like even the mastication, just from the rehab perspective. Because I know your system is probably different than here. Like being in Canada and stuff, I don't know. Like when you discharged him, how many days after like the drowning did he go start the hyperbaric therapy?
So, yeah. So on day 27, we said we're getting him out. We had to sign like a release form saying if he dies and whatever, we're take accountability. And I knew that I had to get to know how to take care of him on my own before I was in New Orleans and on a plane. And so we
Yeah.
stayed at our house for 5 days, just waking up through the night, giving him all the meds, doing all the, the tube stuff, the food, like all the liquid, like everything. Right. And when we realized, like, okay, we're pretty good with this, we prayed a lot, and it was like, okay, we got to go now. And it was the 33rd day post drowning that he had his first hyperbaric. And it was July 4th. I still remember we landed on July 3rd. We did the first session on July 4th. And that was that. It was just like, yeah, it was like a race against, but I felt that urgency. Do you know what I mean? Like I felt that feeling. What was like, no, like the more long you wait, the worse this is going to get. Like get him there.
Yeah. I just wonder, because I feel like in the US, if you did that, they probably would like withhold your child from you, right? Like I think that's right. When you said that, I was like, I think working in the system, especially I'm in like the Tampa Bay area. I mean, there's a lot of kids that like if you go against kind of what the hospital says, they basically it becomes like a CPS kind of medical neglect, whatever. And I think, I think coming from the medical side, and working a lot with brain injury and stuff, you see, like you said too, it becomes science, right? Like this and that. And we see so many miracles or like things that happen that disprove science, yet science is trumps everything. And I think of the way our system is set up too. It's like you do this, and then if the parent is resisting and they don't feel like, oh, it's going to be detrimental to the child, like you would probably not be able to see, if you were that adamant. So I love that you were able to do that. And I think that's the difference with healthcare systems. Did they give you backlash, or did they just more like
definitely
say it's your choice, it's your child?
They basically kind of wanted us to be very afraid. Like it was definitely a fear mongering tactic. So they're like, he's probably, because at that time he was not digesting the formula food they had, they were giving. And I tried to do organic kind, and his belly was just not all those meds, right? It was just like he kept throwing up and he was aspirating a bit. And so they kind of feared us, like if he's going to throw up and die from aspiration, like that was what they kept kind of saying. And I just said, you know what, I get it, but dude, like I have to move in this direction. I know that I know. And I think because they knew I wanted the hyperbaric, and I had gotten also Dr. Harch to phone their doctors.
Okay.
So there's a bunch of other little pieces to it where they knew we were trying to get other treatment for him. And I think that's maybe where the, sort of flexibility came, where they weren't, thinking we were just neglectful or whatever. They were like, oh, they're trying to do something they believe is the best thing. So I have a feeling that's why it was okay. But I was also doing other weird stuff. Like Dr. Hirsch talks about giving like the nasal oxygen cannula in the hospital as soon as possible. And the, the hospital was like, well, we don't do that. Right. And so like I could tell you stories, but there was like an oxygen thing on the wall, right, in the hospital. And I had a nurse from my church that gave me like the mask and the thing. And so I told Dr. Harch said like, okay, put it on this setting. And so when they would like go, I would put the curtain around and I would like get the nose thing in for him, and I would start doing the oxygen, because I just knew that whatever this doctor is doing is helping some kids, right? And so when you're a mom and you're just like a mama lion and you're just like, it is life and death for my kid. Like, I don't care about what you think, right? Like, that's where it got to for us. I can laugh about it now, but at the time it was really scary, right? Like, it was just
Well, it's
like,
almost kind of
gotta do
sad that
this.
yeah, it's like you almost laugh. I think like I sometimes will use humor to kind of like you look at bad stuff that happened in your life and you're like, that's so messed up, and I can be really sad about it. Or sometimes you have to find a little humor, but if you think about that, like it's oxygen, right? It's not like a medication, yet they're probably giving your child meds that are doing all sorts of neurological changes and side effects and
Mhm.
whatnot. Um,
Yeah.
so like what's the big deal with adding a little extra oxygen, like,
Yeah,
but
I
I think
know.
you had to, like, be incognito about it, and I think it's like you're like the underground. I even think about that with intensive therapy, right? Like I always like, it's not even a joke, but it's just like there's only so many people doing intensive therapies and opening intensive therapy centers, and you're like private pay and you're like going against the grain, and it's like,
Yeah.
this is like what works. And then my eyes have been open more to like, are we trying to restrict progress and we're keeping these kids sick? And and debilitated. So, because what happens? Like, does it become a money making thing? We know better
Yeah.
now. So what?
Yeah.
Like, I just don't get it. It's just like, how the heck can we see like? And I think that's why a lot of intensive therapists we're like, hey, we're on social media. Initially, when I opened up, I was like, I'm not doing that. I'm not gonna put myself out there. And then I was like, okay, free marketing. And then I'm like, oh no, it's because you're just like you're so conditioned and you're so brainwashed to like this is what you should do, whatever you should, but then like parents are like sharing all this stuff about their kids, like, look what my kid's doing and all this. And I'm like, no, this needs to be shared. And I think even me
Yeah.
doing like a podcast and doing all this other stuff, I hate being in front of the camera. I hate attention, actually. I hate attention. And but it's not about attention. It's about getting the word out there and talking about stuff. And then,
Yeah.
but it's like why is this such like you feel like well, I have to be private pay because insurance won't pay for it, Yeah, I know what I'm doing is helping kids at a way deeper level than
Yeah.
and getting them someplace further than they've ever been. And it's like when you see
Mhm.
kids come and they're 7 years post brain injury. I have one child, I have a lot of kids that come in that are so far post, and it was back in the day, I was like, they're
Mhm.
not going to make any more progress. And we know that's
Mhm.
not true now, right? But like I had one kid I actually worked with in Michigan, and he came down here to the clinic, and he had a hemispherectomy, which is part of your brain's removed,
Mhm.
right? Presents very
Wow.
much like a hemiplegic child, whatever. And
Mhm.
like his results, like, I mean, he's on my Instagram page because he's just in. I was even like, is that really happening right now? Like, I knew he would make
Mhm.
progress, and I worked with him before,
Yeah.
but what he was doing at the end of 2 weeks was like mind-boggling. After and he was a lot of times when kids have part of their brain removed, we're told, I mean, they're gonna
Mhm.
just be a hemiplegic kid. No, not saying that's not true. Um, like, oh, but what if we gave them really good therapy and intensely and whatever?
Yeah.
Like, I was like, okay, in 2 weeks, imagine if he had more of that. And imagine if he
Mhm.
had gotten that even earlier after surgery. He had intensive therapy. It was just a different component to it.
Yes.
So it's like
Mhm.
why are we taking away these more natural? Like, to me, therapy's natural, right? Like intensive therapy, like we're not giving kids meds, we're using tools, we're using so many beautiful tools, motor reeducation, and we're using just natural stuff, and we're seeing
Mhm.
kids change and get their function back. So like oxygen,
Mhm.
it's oxygen,
Yes.
right? Like, why is that such a
Yeah.
dirty thing that you give your kid?
Yeah.
um, and
Right.
it makes you start to think a little deeper of like, why is
What are
this,
we
right?
doing here? Yeah.
Well, yeah, like but it's like you said, it doesn't follow that protocol of this is what you do
Mhm.
when a kid does this. And did you feel like,
Yes.
I know you said like you really felt like led by the Holy Spirit of like, this is what I should do. So I'm
Mm.
gonna. Did you have a
Yeah.
lot of peace about every decision you made, even though people were telling you it was
Yeah.
crazy? Okay, yeah,
It's funny because, like, well, first I'll just speak to what you're talking about. And I think, like, that's what's so unique about you is that you're the one they come to when all these words, maybe, or prognoses and different, diagnostics have been spoken about people's children. You're not going to let those things determine what you will do and the things that inform, like, the type of therapy you do to allow, those breakthroughs to happen for
yeah,
kids. Right. And
yeah,
so that's why you're such an anomaly in this world of therapy, is that most of them already see the kid coming through that lens of like, okay, they have this is where they're going to end up. Like, when you do that, you are closing doors on these children, right? And when you're doing it, you're saying, no, like, it's up to God, and it's up to, me to be led and do these things that I feel, will give this child a chance, and then the rest is up to him, right? Like, and that is how miracles happen. So I
yeah.
just want to say, like, I'm in awe of, what you do and the perspective you have and how you're willing to go to bat and just do things differently, right? And that's how I think all of the like the breakthroughs happen is you have to be willing. Like that is science, right? Being willing to like step into, oh, will this work, right? And trying those new things and then realizing, okay, yes, it does, and having that documented. So, but it all has to start somewhere. But your question was about, can you remind me again? I forget what you asked me.
Yeah, just about like the peace that you felt. Like I said, a lot of times you're making these decisions of like, I don't know, like you're probably being led without, I think when you go through a traumatic state, like you're
Yeah.
in a fog, right? So like I think back in
Yeah.
my life too, like did I make all that? Yet I had such peace and clarity about making those decisions, and they were big decisions. Now different, I had a totally different situation, but same for you. Like those are big decisions to make, to like be like, oh, I'm gonna like pull my kid out of a hospital and
Yeah.
out of like a traditional rehab model, probably, and
Mhm.
then just go and do hyperbaric. But so you obviously felt led, and then I just said like, what kind of like did you
Yeah.
have peace that whole time? Like you just knew that's what you should. That's what.
Yeah, I did. Every time I felt like I thought of listening to, it was almost like what I would describe as discernment. So, like when
Yeah,
doctors were talking, but they were speaking death and speaking, oh, you should think about hospice for him, or you should think about this and all that. It was like my spirit inside was like, no, like I disagree, right? Like it was just like no. And in the spirit realm, for those of you that work in this area, and this is something we do in prayer ministry, what you come
yeah,
into agreement with is what you will give power to in your life. So if
yeah,
you come into agreement with the lies that people are speaking about your destiny, or about what you're meant to do, or about the trajectory of your child,
yeah,
or you come into agreement with the way someone sees you, and it falls short of your purpose and your destiny in God, you're allowing that power to take up space and to control your life. So I know that sounds extreme, but that is what, when I had these doctors saying these things to me, I wasn't rude about it. I wasn't like, you're wrong. And I do want to, also say I have respect for medical professionals that do awesome things in the medical field. But with my
yeah,
experience, they did not understand my son's destiny. They did not understand his healing trajectory. And they were just speaking based off of their own experiences. And so I had to, like, there was something in me that was like, nah, right? And I would just smile and nod and go, and then I would just go, no, we're going to do this, and that, like, I just kind of would move it in a different direction and like made those choices. And I would describe like a divine peace, but also that I was being led by something that was not like human. Like it wasn't like
yeah,
my own, like you said, when you were going
yeah.
through your trauma, you were not, it was like a supernatural leading that was happening that was not me. It was
And
not
it
me. It
doesn't
was
make
the
sense.
Holy Spirit.
Yeah, and
It
it
doesn't
doesn't
make
make
sense to people. It goes against all the advice. It goes against the rational. It goes against all of it. And I still remember, even like we had warfare, like even a day before we were supposed to get on the plane,
Yeah,
some pastor's daughter had a friend who knew Dr. Hart or something, or had their kid go to him or something, and then started saying things like, oh, he just takes people's money and he's not going to like really help and all this other stuff. And I just caught it right away. And I was like, what the? And our family was just saying this to us, thinking like they want to protect us if, there's something that
oh,
we
yeah,
should
yeah,
know about.
yeah. But you knew
And
that what that
I
was.
knew right away. I was just like, nah, nah, nah. I was like, Satan, like, you can get the heck off of this situation right now. I knew
Yeah,
that it was BS. And I just was like, I know my son is supposed to go see this doctor, and nothing, no words, no, no fears, nothing is going to stop what I know by God is supposed to happen for him. And this is the next step I'm taking. Right. It's like, yeah, I mean, you see it in stories in the Bible too, where, like people, the disciples, like they go and put themselves in situations that are just like, what the heck are you doing? But you just know that it is like God is gonna watch over you in that, right? So yeah, that's kind of how, what's that?
So kind of like the David and Goliath. It's just like, well, and they
Yeah.
kind of say too, when God has like a bigger purpose, it's like beyond our understanding. But sometimes like they'll say the devil will like attack harder, right? And for you to have that ability to distinguish what's coming, that's if you're being led and you just can like surrender a little bit of like, what am I supposed to do? You're not trying to control it. I
Yeah.
think that was my experience of like, and I never had done that
Hmm.
before, really. But it was like anytime I tried to control it and do what people told me, it would like backfire on me. And that if that wasn't God trying to be like, no, like you're going here. I want you to go here. I want you to go here. I want you to do this. And it was like
Yeah.
during the worst time I should have been doing it. But that's the
Yeah.
like the beauty of it. And that's where I also think that God wants you to, it's like share your testimony, because I want to let other people know like how I'm working, how I
Mm-hmm.
work in people's lives, right? And I, it's yeah, it's a weird. Sometimes when you see people go through stuff, you're like hoping they like go down this path so they can like experience what you experience, because it was like the most comforting thing during the probably one of the hardest times in your life, right? And it
Yeah.
I don't know how to explain it other than unless you experience it yourself. I think
Hmm.
so I feel like I know what you felt, because and then you probably look back
Hmm.
to it, that's why you probably like laugh at yourself, because you're like, I did that. But something else was like leading you to do that, because it was like, okay, this is going to help your child more than this, right? And the snowball effect of everything that comes after it, but you're just being led by something bigger. And it was
Yes.
at a weird time where you're, I don't know, it's just a cool thing.
Hmm. It is. I'm eternally grateful and thankful. And, it's like I was so worried for the longest time. And, we have an Instagram following. You can follow Raya at Raya's Revival Story. And it's like, I was so worried sometimes of like, what if I post this and it like hurts somebody, or it's like, it's offensive or they don't understand. And God said to me, like, this is your story. I didn't allow you to go through this so that you could shut your mouth and not share, what my work has been in this process. And so, the devil will always try to quiet you and silence you, especially where God is using you, right?
Yeah.
And where he wants you to have gone through something for a purpose to help inspire and uplift and support others. And so, that's where I kind of had to go, okay, God, this isn't even about me. It's not really even about me. It's not even, of course, like, yes, it's about Raya and his life, but it's not even really fully about him. And, we get into that place of sometimes victimhood too, where like, being a parent of a child with a brain injury, you can really start to just fall into that.
Yeah.
Like I feel like the whole world is against me, the medical supports and other people, and I'm misunderstood. And, like it isolates you in such a big way. Um, I just kind of have to keep reminding myself that, it's not really even fully about me. And I don't really fully understand why it happened or how, it's being used, but I do know that God is at work in this situation. And I do know that even my son's story is about more than him. Like we had people like coming and talking to us and being like, I didn't believe in God for my whole life, and I saw your son's story and I started to like believe, right? Or I started to believe in healing. I started to believe that healing is possible, right? And so it's just bigger than us sometimes. And we just have to trust that if we're just being obedient to the next step, that everything else is just going to kind of happen the way it's supposed to. Right. And just like sometimes I say to myself, like you were saying, you don't like being on the videos and stuff like that. I don't either. It's not my comfort zone. And I'm like, get out of your own way. Like, you get out of the way and like just let God do what he wants to do, and don't worry about who likes you, who relates to you, right? Like, who has opinions. Just be you and talk about, your story from your heart, and glorify God in that process, and the rest will just happen the way it's supposed to. So
yeah, and I don't think it's everybody is meant to tell their story. Like, I think that, I think a lot of people that are like the critics, it's like, maybe you're not meant to tell your story. I mean, like, I think that the more I dig into my faith and stuff, it's like God gives you, like, he has a path for you, right? Like, and even if you start to look back at, like, I think of all the little things that happened in my life before that led me to be prepared to do what I'm doing right now. It's like I had to go through all that, and like some of those decisions that I had to make, even just like doing like teaching, like right after I had my first son, I remember one of my professors was like, "Hey, would you be interested?" I used to take a lot of students, and I never thought I'd get into teaching or research or any of that. And then I did, and I
yeah.
loved it and stuff like that. But it wasn't even that. But like now I look at everything I'm doing through my clinic, and when I opened this clinic, I was like, I'm just going to see some kids, do some intensives, and then it like blossomed from there. And then I was like, oh, okay, people like, you're doing some things differently. I mean, it was just like one thing after another, and then other things would present themselves. And I was like, oh, wow, this is so cool. This is so tied to like other decisions that were hard for me to make. And then I was kind of like,
Yeah.
not that I think I was trying to control some of that, but I was like, hey, why not? Because that's my personality. I'll try, kind of like, I'll try something. Sure, I'll jump in. I'll be the risk taker. I'll be because that's just who I am, right? But God made
Yeah.
me that way. And so
Yes.
I think it's, like you said too, telling your story, like you said, it's not about you. Like me starting this clinic was not
No.
about me. It wasn't like, oh, I want to start this clinic and I need to, some people are driven when they start a business, they're driven by money, right? Money, like, yeah, you need
Yes.
money to run a business and whatever. But when you drive with purpose, man, it is like a world of a difference, and God provides, right? And I said, don't, and
Yes.
I'm going to be transparent and say, I mean, I sold my house. I, I knew I was supposed to start that clinic. I took money, resources, and changed a little bit of how we were doing things in our life to start it.
Mhm.
And it wasn't like I was like, oh, I'm going to get this house and have it. I had a big, beautiful house back. You know what I mean? Like that didn't ever matter to me. And then I think about God provides in different ways, but when God's providing, He also shows me, okay, I
Yeah.
want you to do more with this. So I'm taking the resources from my little tiny one revenue. I now have a second person generating some revenue.
Yeah.
We're going to go with more programming, but it's not that whatever comes of that is to continually do what God wants me to do and fulfill the purpose. It's not so I can have me, and I think that it's, you can come across, I think sometimes people do lead with that, and it really doesn't end up good, but I think, I don't know,
No.
it's God will provide, but it's just you have to be obedient. And I think that for me
Yes.
sometimes I'm like, why? I can't handle all this. I'll like pray and say, why the heck are we doing all this right now? Like, I feel like, and it's so in my face of like, you need to do this right now. And I feel that. And like you said, you get that overwhelming feeling of like, I'm just supposed to jump in and do it. And
Yeah.
then but there's days where you'll go back and you'll be like, this is too much. Like
Mm.
you
Yeah.
get in your head, you try to control things,
Yeah.
you have like that. And then it's almost like, okay, pray about it, whatever. And then like, God, show me what direction am I supposed to go in? Because sometimes you
Mm-hmm.
do go in one direction, but he'll quickly, if you rely on him, he kind of brings you back and redirects you
Yeah.
back to where you should be, right? And
Yeah.
I think even with your child's care, that's something that I think a lot of parents struggle with because they're doing what everybody's telling them to do, and even if they don't feel like it's the right thing, And I think you're a great testament to no, do what you know is best for your child or what you're feeling, because there's really something bigger leading you in that direction, right? But
Yes. Absolutely. Absolutely. And it doesn't, and to say all that, sometimes it sounds like, okay, it's just easy. Like, you hear God saying this, and I don't want to discount the community of people I had around me praying for God's will to be done, and just the impact that had on my decisions and my ability to hear and know clearly like what way to go. And it's still a heartbreaking journey for us, and for parents who have been through this, like, I see you. My son is not 100%. He's got healing to do, right? Speech is a big one we're working on right now. And it's like, it's the most bizarre grief journey, because you are living alongside your child, thankful and grateful that they lived and that they have whatever function they have, but also deeply, deeply missing who they were, right? And just, that's the whole journey of when it's like a traumatic brain injury, or the kind of brain injury we had, any kind of accident. It's like you miss and long for your life before, your nervous system before, like, oh my goodness, right? Like, we can do healing, but things change us. And it's like, okay, God, like, I'm leaning and trusting on you more than ever before to keep me, well enough and strong enough and equipped enough to do what you've called me to in this life. But it is not easy. I don't want to undermine that at all. And it's a journey, and it's filled with grief, even in little moments, right? And so it's what we would call, like, as a counselor, it's a complicated grief, because it's not just like someone passes and then you go through a deep grief, and that, of course, even in those kinds of griefs, especially with a child, it never really ends. But when it's a kind of grief where you're missing a part of them, but you're thankful, you're grateful, okay, they're here, I still get to hug them and love them, but that, they are not who exactly they are, right? And I mean, my go-to tool and way to go to that is just like, I never give up hope in terms of God's ability to heal. And that's just a part of my toolbox, right? Like, I still lay hands on him and I pray. I still read scriptures over his body, healing scriptures, right? Like, I still, I'm leaning in for the fullness of what God has for him, whatever that looks like. I'm not giving up. I'm not going to give up short of the fullness of the miracle that God has in store for him. Right. And that will look different for every person and every family. But I think having and holding on to that faith is sometimes just what will get you through like an hour of a day. So, yeah.
Yeah. And I think that that's so true. I think, just looking at a lot of the families when working in brain injury, like, they always say that too, you grieve the loss. You did lose a child, right? And you have a new child and you have to learn this new child. And
Yeah.
I think that's something I've seen, that because you're walking alongside these families for years. I think where I was at before, we kind of would do the whole inpatient to day rehab, and then day rehab and then the kids are coming back for episodic care. And so you really walk alongside and see that with families. And I think that's the one thing, pretty much 100% of the families will say that, like, you're still grieving that loss and you're so thankful. And it's this like constant conflict, right?
Yes.
Of what I lost, what it could be, what it couldn't be. But then I think, like, kind of what you're saying too is just, I think that's a normal thing. And I don't think that's abnormal to be sad or to whatever. Because a lot of people be like, oh, I remember, when you go through stuff, everybody wants to tell you how to feel. And I remember at one point, I think I was like, I'm going to have emotions. I'm going to be mad about this. I'm going to be angry about this. I'm going to be sad about it. But if I don't need to sit there, I don't need to sit there, right? Like, I understand life goes on, and we all have some sort of something that comes in, traumatic, whatever. But for someone to tell you how to grieve and like, yes, is it healthy to sit and be sad and depressed and whatever? Not really, because you're not really moving past it, but it's okay to have days like that, right?
Yeah,
I think
absolutely.
there's a lot of struggles with having a child with brain injuries, and we see like a huge amount of people where their marriages are, break apart at some
Yes.
point. You see a lot of, I've seen a lot of it from a different perspective. And I think a big piece of it is too, I don't think that parents ever get a chance to heal because you're
No.
so busy healing your child and physically healing your child, right?
Yes.
And then the siblings, like siblings are affected, like
Yes.
I think there's such a bigger dynamic into like what's going on here, and everybody needs to heal and process this, and it's just extremely complex. It's stressful.
Yeah.
That with brain injury comes all sorts of complexity, even as the child ages and gets into teenage years, and then they don't look like they have a brain injury. And there's just so much to it. And then you're kind of looking, okay, we got them this far and this far and this far, and then you're looking down the road of like employability after. There's so many stages that you have to go through, and it's like going to be a new stage, and then sometimes you're so removed from support by that point, you're navigating it on your own. People kind of forgot about that initial trauma and being
Yes.
so.
Yeah.
So I think, just even with your skills, and you have all these skills, right? Like you help people through all this. And I love to hear that you are like, no, I still struggle still myself, but what a better, I mean, you're going to be such a good person just to like help people get through trauma more because you understand it, right? And I think there's something to be said about the reality of it too. Just it's not all flowers and happy
No.
everything. Oh, you're gonna be great. Like, yes, like I'm a really positive person too, so I can look at any situation and be like, oh, this and that. But then sometimes I think I struggle with being like, oh, that was really sad because I don't want to. Who wants to feel sad? So I'm actually the
No.
opposite. I don't think I could ever sit in depression because I don't like to
Mm-hmm.
be there. I don't like to feel that way, and I'm
Yeah.
so good at like even deterring to like what's so great, and what's so positive,
Yeah. Yeah.
I don't think that's always the healthiest either. You know what I mean? Of kind of, I
Well,
mean, it's better.
it's a coping strategy too, right? Like, having that sort of almost optimal positivity constantly is like it's a coping strategy in itself. But I think it can come with pitfalls where you're like not seeing the reality of a situation, or how does that impact the relationships around you, right, and connection and things like that. But I definitely think that is one of mine as well, right? And I went through a long time where I just thought, okay, well, by the year mark he's going to be healed, right? And so it's like, oh, let's just work, like works in order to get the result you want, right? And I think part of parents, like part of what helps us heal is also thinking we can do things to improve our child. And that makes us feel useful. That makes us feel like we're a good mom, right? That makes us feel there's still hope for the child, right? And so those are also some of the coping tools, to keep going to the therapies and doing the therapies. And I know my husband went through that journey where he had to say to me, like, I think you need a break from the therapies with him because, he's doing good now. And he was just like, you are just, your whole life is just him, his therapies, what his food, him, right? And it's not healthy for you. And I had to kind of go, oh, and take a look back at things and go, oh, this is coping. This is like I'm on a mission to like heal. And that too, I had to like give it back to God and say, okay, God, like, the finances involved, what's involved. I'm going to put his healing back in your hands. And it's time for me to now like heal a little bit, right? And take a step back and do the things I need to do for me and for my other son and my husband. Like there's just so many dynamics, like you said, right? In that process of healing.
And I
So,
think that's huge for recovery, because if you're healing the child physically, but you're not healing what's going on at home. And I will tell you that as an outsider, as a therapist, it does affect the child's progress. When a
yes,
parent's working and there's turmoil at home and there's the stress, and we talk about that nervous system stuff of like when a child's in fight or flight in general, we know that the brain's not developing like it should,
No.
right? Like I did my research on that, like childhood trauma, how it
Mm.
affects the developing brain. And there's lots of science and research out there. We know that certain parts of the brain are not going to develop. So if there's stress at home and there's kids, oh my gosh, it's just like every child I work with, the minute I always love this revelation when I see a parent, because a lot of times parents come in anxious and then they're like, are you gonna help my kid? Are you gonna help my kid? They told me this, just kind of whatever. And then when you get to a point where you start to see the parent come in, and I always see this, like, it's just like a difference in them. Like, okay, I'm empowered, my kid's doing okay. So sometimes when you see some healing going on, I see more healing in their child. And
And
it's an
that's
emotional
cool.
healing too. And I
Yeah.
think that's even the sensory kids. So even outside of brain injury, there's a lot of kids with like sensory processing disorder. A lot of times these kids are going to centers and it's like they go to their OT and then they go home and there's like no education. Not saying every place, but like no education. Parents don't understand their kid. And it's just like an hour a week. That's not going to even change anything. And then the parents sometimes will come and I'll be like, hey, what education have you done? Whatever, and they're like, I don't know. And that's just like this constant, because these kids are in fight or flight all the time. So are the
Yes.
parents. And then the parents' behaviors happen so long story short, it's just like um I'm huge on like educating the parent. If you ever come to my sessions, like it's just, I'm kind of annoying probably because I'm like, this is why I'm doing over education, but I'm also trying to get you to understand your child and how to work with them and understand why they do certain things. And same with the sensory stuff. It's like the minute the parent can understand their kid, and yes, the interventions are helpful, but I'm like, do these little things, but once they understand their kid and why their kid's doing it, and then they can redirect or pull in an intervention that's actually beneficial, that's helping their calm their central nervous system. It's like you see the parent come in like, oh, so happy, oh, they slept through the night, and the kids, it's just like the dynamic of the child and the parent. And
Yeah.
and I think what we neglect a lot too is children as they are developing, if you just give them safety, security, and love, right? Like they will thrive. You could be living in a car with the child and they feel safe, secure, they're being fed, their basic needs are being met, and you're going to see a better result than the child that's living in a big mansion and maybe their parents are just like in and out and they just feel very insecure and dysregulated, and like there's a huge difference in
Yeah.
development and just how things are go about too. So I think but I think a lot of parents are not getting the time to heal because our society tells us we don't have the time. And I know a lot where kids had traumatic brain injury, and by the time they got to the outpatient intensive therapy still, their parents were like having to go back to work because they needed to make money. They needed to keep the insurance. And so
Yeah.
when do you get time to heal? Like, when do you ever get time to heal? Because you're so busy caring for this child who now has increased
Yeah.
needs. Like you said, life goes on. So I think that's one big thing. And some parents might be like, oh, I'm going to therapy, but what kind of work are you able to even do for yourself? Because you can go to therapy for an hour once a week, but you're probably rushed. You're probably not getting as much out of it. So I think just pulling in like healing and providing more healing and telling parents it's okay for you to take time away and heal yourself.
Yes.
Right.
Yes. And that's often too with, like, I mean, I know in my case, like being afraid to leave your kids, right, with others and with their high needs. And just when your world gets opened up to accidents happen and bad things happen, your brain starts to go bing, bing, bing and start to imagine all these things, right? And so part of the trauma is also how to manage those thoughts. And the nervous system can also trigger the mind to think in that kind of way when you're in fight, flight, or freeze. Often the sympathetic nervous system puts our brain into that survival. So the only kind of thoughts you're having are not emotionally processed thoughts of problem solving and solutions. They're all thoughts that are related to like survival or life and death or, worst case scenarios, and so once the nervous system switches back into that parasympathetic state, then your brain and your mind can start to have some of those more functional thoughts, right? And you can start to like look at the patterns in a way that, okay, is this helpful or is this hindering, right? Like if I'm my only child's lifeline, how is that going to impact my life and the ability to be healthy and get rest and all these things, right? So detaching from some of those narratives in our mind about that we can't leave our kids with others and that we can't trust this and that, right? And turning off those alarm bells in the nervous system and then coming up with other ways to heal, right? And in important things that I think every family needs just as a regular parent, never mind one that goes through tragedy, right? And trauma. But that kind of leads us into talking a little bit about what we're thinking about and what we're talking about. Do you want to talk a little bit about that?
So I think when Natalie and I were talking, we kind of led into, I think we both had kind of kept having like these ideas. So we talk about being led by the Holy Spirit a lot, but it was just kind of like, I always, we should do a retreat, So doing a retreat. And I was kind of like, okay, I would love, because I see that dynamic, right? And I think I've seen it my whole career. So it's just like, I just see so many parents that aren't being healed. And the first time I actually really even thought of something like this was when I do beach sessions once in a while. And I remember those, over time, I was like, that is like more healing for the parent and the child because they're
Wow.
sitting on the beach. That's the first time that parent probably has sat and relaxed on a beach. And there's something about the sun and the sensory component of like waves and all that. Your child's getting therapy, your
Yeah.
child's having fun, laughing. You're seeing them do some new things because the whole experience doing therapy on the beach. And it's, to me, I was like, oh, this would be so cool to have like, what if I always dream big because I was always like, I'm a big visionary and I know like I always just think I don't really think that's true. Like I think I always had a big imagination as a kid too, but I always envisioned so cool to have a whole center on the beach and then you could do the beach therapy and the people could come and stay and it would be just healing for everybody. But then I was like, oh, the retreat thing. So I think we just talking about doing intensives and then having, the parents getting kind of their own healing component to it and then combining it. But I think Natalie and I were talking more about what if we started with just the parent and do a shorter period and then evolve it from there. Because I think there's so many avenues we can go, but I think what an awesome thing that would be for parents is just maybe starting with a weekend. I think we talked about doing like a weekend.
Yeah. Yes. So I think, as Jenny was saying, it's like one of those things that I think is something that's just been dropped into both of our spirits where there's a need for recalibration and healing for parents who've gone through something like a traumatic brain injury or just caring for, being a caregiver. And my background a little bit, I've done retreats where we incorporate some spiritual practice, hydrotherapy, even nervous system based work, as well as even some of the prayer ministry stuff. And so our vision was kind of how can we create a weekend where parents come really just devote the time to themselves, work on their nervous system. So, will probably be, breath work, grounding work involved. We would do some prayer ministry stuff if that, fits for people. That can be an optional component around trauma, right? And grief and, guilt, shame, all these things that can come with the process of caring for a child with some sort of special need. And then, all those things that are good for the nervous system and the body. So, picturing long walks on the beach, right? And as Jenny was saying, like the sensory components of getting your sunlight, your water, your ocean, your salt. And then, the counseling aspect of that. So group sessions, right, around maybe grief or some coping strategies, some nervous system work. I also do a technique called emotionally focused tapping, which basically taps into um, the nervous system and what's going on in the body as far as all those chemicals that get released when we're in fight or flight. And when we tap on those areas, it essentially pauses that flow of those stress hormones, and it kind of gives our body a chance to get reset back into that parasympathetic state. And often we will pair those with affirmations, becoming aware of like the emotions that are coming up for us, and just attuning ourselves to, okay, like where are things right now sitting in my body, right? Because we hold a lot of that stuff in our body too. So we're I'm very excited about what God is doing and what we have come together to kind of think about. And we'd love to hear feedback or interest from all of you, and just what you think you would be excited to be a part of as well. And I know, Jenny, you have some ideas too about the physical component stuff, because you do so much more than just like OT stuff, right? Like you have so many cool different modalities that you offer that can kind of create that healing atmosphere for the nervous system as well. So I think it's going to be amazing. Mhm. Mhm. Yes. Mhm. 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 Yes. Mhm. Mhm. Yes. Mhm. 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 Yes. Yeah. Well, it's okay. It's good. Yeah. Yeah. Mhm. Mhm. Yeah. That's beautiful though, right? We need people around us that see what God sees in us, and he is pursuing all of us, right? Even on our different journeys. Like I have a journey with my testimony too, but I won't get into that, but it's, like he is pursuing all of us, and the beauty of who he is he knows exactly what each of us needs given what we've been through, our unique makeup, how he created us, like the purposes and plans he put inside of us. And, none of it is by mistake, right? And the connections we make and the people we're drawn to, like, that isn't by mistake either, right? He works through people and through connections, and it's all for his big divine purpose. Like we don't see it, right? I don't even begin to, like, I try to stay humble. Like I don't know what it is, Lord, but I'll just take that next step. And I know that you're going to show up if I'm obedient to that. And so I think that's kind of what you and I are doing, or wanting to step forward in, is just being obedient to, like, this vision, this dream he's kind of like planted in our heart, right? And that's cool too, because it was not even something either of us like really planned to like say to one another, but we each had our own experiences and then realized, like, oh, this is what God wants us to do. So that's so cool. I love that. Yeah. 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 Yes. Mhm. Mhm. Yeah. Mhm. Yeah. Mhm. Mhm. Yeah. 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 So yeah. Yeah. Yeah, and feel free to ask questions too. Like if, you're just not sure if this is for you or whatever, just ask us some questions, and yeah, we're just trusting that there will be people out there that this is going to be perfect for. So also, if any of you feel you do need a counseling session or prayer ministry, I do offer online sessions. I'm gonna Jenny will probably have my website and my Instagram. It's at Natalie Hope Healing, all one word, or nataliehopehealing.com. You can kind of find me there if that's something that you feel connected to. I'd love to hear from you. I'd love to support you in your journey. Yeah, and I can't wait to meet some of you in person. And Jenny, I got to meet you, and Raya's got to see you at some point. So. Yeah. Yeah. Yes. Yes. Mhm. Mhm. Yeah. Mhm. Thank you. Thank you so much. Yeah. Mhm. Yeah. Yeah. Absolutely. Mhm. Absolutely. Would love to hear from people. And thank you so much for having me on here and just like saying yes to that next step. And I just love how natural it's all happened. And yeah, cannot wait to meet you in person and all the exciting thing God has for both of us. So, yay.